Hello and welcome everyone. So the PDCET 2026 exam is approaching now. It's on 12th of April and I'm here with one more short lecture for the PDCET Pediatric students. And uh, this is a lecture on 100 important one-liners which are expected in any form, either a direct MCQ or a part of or option of MCQ. So we will try to revise these important one-liners as soon as possible in a short video. So target SpO2 during neonatal resuscitation at 10 minutes. We should remember at 10 minutes it's 85 to 95%. So this can be directly asked. Now first sign of successful positive pressure ventilation in a neonate. When you are giving positive pressure ventilation to a neonate, what is the first sign of successful positive pressure ventilation? It's increase in heart rate. The increase in heart rate is the first sign of positive pressure ventilation success. What is the indication of umbilical venous catheter, UVC line in neonatal resuscitation protocol? And heart rate remains less than 60 beats per minute despite 60 seconds of effective PPV in chest compressions. So if also the point to be remembered is 60 seconds. So after 60 seconds, if of effective PPV in chest compressions, if heart rate is still less than 60, then the UVC is to be inserted. Early onset sepsis, EOS in India. So the most common organism is Klebsiella, and globally the most common organism is group B streptococcus. So it's about early onset sepsis. Now therapeutic hypothermia must be initiated within 6 hours. So 6 hours is important time of birth. For moderate to severe HI it's indicated. Target core temperature is 33.5 degrees Celsius, and for how long duration? 72 hours. So these can be the different options of MCQ A, B, C, D. A is we're just not sure about therapeutic hypothermia. So initiated within 6 hours and indicated for moderate to severe, and the target core temperature is 33.5 degrees centigrade, and the duration is for 72 hours. So these can be asked in MCQ easily. Milk fortifiers usually added to express breast milk once the baby tolerates 100 ml per kg per day of feed. So this can be an indirect question. It can be asked that when milk fortifiers can be added to a baby who is receiving express breast milk. So only when the baby achieves the feed of 100 ml per kg per day. Value-based questions. So lecithin sphygmomyelin ratio, the LS ratio, value of more than 2 indicates fetal lung maturity. But also remember, in case of diabetic mother, infant of diabetic mother, this ratio should be more than 3. Apnea of prematurity. Defined as cessation of breathing for more than 20 seconds or shorter if accompanied by bradycardia or cyanosis. So the duration of cessation of breathing is more than 20 seconds, and it's known as apnea of prematurity. Or even if it is less than 20 seconds, but it is accompanied by bradycardia and cyanosis, then it can be termed as apnea of prematurity. Now, drug of choice for apnea of prematurity is caffeine citrate. It's superior to theophylline due to wider therapeutic window. So, caffeine citrate is drug of choice. And why it is drug of choice, or why it is superior to theophylline? Because it has wider therapeutic window. Now, vitamin K dose is 1 milligram IM for babies more than 1500 gram and 0.5 mg IM for babies less than 1500 grams. Retinopathy of prematurity, that is ROP screening, first screen at 4 weeks of life or 31 weeks post menstrual age, whichever is earlier. So, when first time ROP should be screened, either at the 4 weeks of life or 31 weeks menstrual age, whichever is later. Okay. So most sensitive indicator for neonatal sepsis is C-reactive protein. When serial C-reactive protein measurement is most sensitive indicator. And late onset hypocalcemia, it is again important, typically occurs after 72 hours, often due to high phosphate load or cow's milk. So what is late onset hypocalcemia? If it occurs after 72 hours of birth, and what is the cause? It can be due to high phosphate load because of cow milk. So cow milk is to be avoided. Persistent pulmonary hypertension of newborn, that is PPHN. The gold standard treatment is inhaled nitric oxide, as you all know. And necrotizing enterocolitis, that is NEC, which is the pathognomic X-ray finding in NEC. It's pneumatosis intestinalis. That is gas in the bowel wall. So pneumatosis intestinalis is the pathognomic of X-ray finding of NEC. The most common CSG in children, VSG is the most common CSG, perimembranous subtype. Most common cyanotic CSG overall is pathology of palate, and most common sanitary CSG in the first 24 hours, which is getting presented. So it is TGA, transposition of great arteries, because TOF gets presented later. An egg on string appearance on X-ray is seen in transposition of great arteries. Snowman or figure of 8 appearance is seen in supracardiac TAPVC, total anomalous pulmonary venous return. So remember these signs: egg on string sign on TGA, snowman or figure of 8 appearance, supracardiac TAPVC. Boot-shaped heart in tetralogy of Fallot, box-shaped heart, Epstein anomaly, continuous machinery murmur is seen in PDA, widely split and fixed S2 is seen in ASD, atrial septal defect, and drug of choice to keep PDA open. Okay, PDA open is alprostadil, and drug of choice to close PDA is indomethacin or ibuprofen. And IV paracetamol is a newer alternative. Indomethacin or ibuprofen is not available. Jones criteria, echocardiographic carditis. It is subclinical carditis is now the major criteria. Most common cause of myocarditis is Coxsackie B virus infection, which is the most common cause of myocarditis in children. Kawasaki disease, most common cause of acquired heart disease in children in developed nations. It is Kawasaki disease. Noonan syndrome, it's associated with pulmonary stenosis. So questions on syndromes are usually asked. So Noonan syndrome, it is associated with PS. Williams syndrome, associated with supravalvular aortic stenosis. It is important, has been asked previously in exams. And infantile spasm, that is West syndrome. It is the triad of spasm, mental retardation, and hips arrhythmia on EEG. So important, what is the finding in EEG in West syndrome? Hips arrhythmia is seen. Drug of choice for West syndrome is vigabatrin for if patient is of tuberous sclerosis or ACTH is given. So what is the drug of choice for West syndrome? In case of tuberous sclerosis, it's vigabatrin, and other cases, it's ACTH. Steroid is also the alternative option, if not the cost factor is there. So benign rolentic epilepsy, most common focal epilepsy in children, and it shows centrotemporal spikes. So it is also termed as benign epilepsy with centrotemporal spikes, PECs. Absent seizures characteristics. What is the EEG pattern? Important, 3 Hz spike in wave pattern on EEG. So what is the frequency? 3 Hz spike in wave pattern on EEG seen in absent seizures. Now drug of choice for absent seizures is ethosuximide, but it is not available in India, so we can choose, if it is specifically asked, then we can choose option valproate. Okay, in India we give valproate. Duchenne muscular dystrophy, DMD is most common muscular dystrophy, and Gower sign is positive. That is difficulty in getting up from sitting position. So Duchenne muscular dystrophy is the most common muscular dystrophy, and Gower sign is positive. Spinal muscular dystrophy SMA mutation is an SMN1 gene, which is on chromosome 5q. The SMN2 gene, if the number of copies of SMN2 is more, then the severity of spinal muscular atrophy is less, and it's vice versa. Okay. The modified Bell stage is used for grading of NEC. Hutchinson's triad, interstitial keratitis, sensory neural deafness, and Hutchinson's teeth. It is seen in congenital syphilis. So Hutchinson's triad is seen in congenital syphilis, and what is the triad? Interstitial keratitis, sensory neural deafness, and Hutchinson's teeth. Now, cherry red spot on macula is seen in Tay-Sachs disease, Niemann-Pick type A, and GM1 gangliosidosis. So MCQ can be asked with option A, B, C, and D option with all of the above. So cherry red spot, Tay-Sachs, Niemann-Pick type A, and GM1 gangliosidosis. Angelman syndrome, deletion of maternal 15q1113 is happy puppet syndrome, and Prader-Willi syndrome, deletion of paternal 15q1113 is hyperphagia and obesity. So Angelman, maternal deletion, Prader-Willi is paternal deletion. Down syndrome, trisomy 21, most common chromosomal cause of intellectual disability. Edward syndrome, E for Edward, E for 18. So clenched fist, rocker bottom feet, and micrognathia is seen. Patau syndrome, trisomy of 13, midline defects, that is cleft lip, cleft palate, holoprosencephaly or polydactyly. So midline defects are seen in Patau syndrome. And also remember the trisomy number 13. Turner syndrome, 45XO, the short stature, webbed neck, and streak ovaries are the features of Turner syndrome. Inborn error of metabolism, most follow autosomal recessive inheritance. Mostly is biochemical disorders follow autosomal recessive inheritance. And maple syrup urine disease, defect in branch chain alpha keto acid dehydrogenase. So defect or deficiency of branching alpha ketoacid dehydrogenase is seen in MSUD. And phenylketonuria, what is the order? It's mostly or musty order of urine, and a defective phenylalanine hydroxylase. So phenylalanine hydroxylase defect is seen in phenylketonuria, and the order of urine is mostly or musty order. Alkaptonuria, urine turns black on standing, and defect is in homogeneity state oxidase. So remember the defect, the urine characteristics of these diseases. Cystic fibrosis, defect in the CFTR gene, which is on chromosome 7, and the most common mutation is delta F508. So each and every word of these lines are important. MCQs can be asked from these points. So cystic fibrosis, defect in CFTR gene, chromosome number 7, and most common mutation is F508. Sweat chloride test, diagnosis for cystic fibrosis if the sweat chloride level is more than 60 milliequivalent per liter. Measles, rubella, complex spots is seen in measles. These are pathognomic, and it occurs opposite to the lower second molars. So, complex spots seen in measles, pathognomic of measles is complex spots, and where complex spots occur, it occurs opposite to the lower second molars. Now, hand, foot, and mouth disease caused by Coxsackie A16 or enterovirus 71. These are the two common organisms for hand, foot, mouth disease. Rosella infantum, also known as exanthem subitum, fever disappears, then rash appears. It's caused by human herpes virus 6, so HHV6, Rosella infantum, and fever disappears and then rash appears in this case. Wiskott-Eldridge syndrome, triad of Wiskott-Eldridge syndrome with thrombocytopenia, small size platelets, eczema, and immunodeficiency. So Wiskott-Eldridge syndrome is triad of thrombocytopenia, small platelets, eczema, and immunodeficiency. A chronic granulomatous disease, defect in NADPH oxidase. So what is the defect in chronic granulomatous disease? NADPH oxidase defect, and it is diagnosed by DHR, that is dihydrodamine flow cytometry. And D. George syndrome, catch 22, uh, mutation cardiac defects, abnormal faces, thymic hypoplasia, cleft palate, hypocalcemia. Options sometimes have thymic hyperplasia or hypercalcemia, so you have to rule out these options in MCQ asked for D. George syndrome. So catch 22 mutation, cardiac defects, abnormal faces, thymic hypoplasia, cleft palate, and hypocalcemia. All right. Now, other is Bruton's A gamma globulinemia. What are the important features? It's X-linked, total absence of which cells? B cells. Options can they can ask T or B. So B cells, and BTK gene mutation is seen. So Bruton A gamma globulinemia, X-linked, total absence of B cells, and BTK gene mutation. Please, students, keep in mind each and every word of these lines are important. Okay. Most common childhood cancer is ALL, that is acute lymphoblastic leukemia. Most common solid tumor in children are brain tumors. Most common extracranial solid tumors are neuroblastomas. Neuroblastomas, these arise from neurocrest cells. So vanillyl mandelic acid VMA is elevated in urine. So these are features of neuroblastoma. Wilms tumor nephroblastoma does not cross the midline associated with PAGR syndrome. So which of the following tumor does not cross midline? The answer is Wilms tumor or nephroblastoma, and mutation WAGR syndrome. Syndrome association is WAGR. Now, Fanconi anemia, most common inherited cause of bone marrow failure, and shows chromosomal breakage. So, Fanconi anemia is the most common inherited cause of bone marrow failure, and it shows chromosomal breakage. Diamond-Blackfan anemia, pure red cell aplasia associated with triphalangeal thumbs. So, what are the features of Diamond-Blackfan anemia? Pure red cell aplasia, PRCA, pure red cell aplasia is seen, and also it is associated with triphalangeal thumbs. Now, about ITP, immune thrombocytopenic purpura, it typically follows the viral infection, and management is usually supportive. Platelets are more than 20,000. Thalassemia major, hemoglobin electrophoresis shows absence of hemoglobin A and high HbF levels. Acute epiglottitis, its emergency, and thumb sign is seen on X-ray. It's caused by Haemophilus influenzae type B. So thumb sign on X-ray is seen in acute epiglottitis. Now laryngotracheal bronchitis group, the steeple sign on X-ray, and it's caused by parainfluenza virus. So these two are important: acute epiglottitis, thumb sign, Haemophilus influenzae type B, laryngotracheal bronchitis, that is group steeple sign caused by parainfluenza virus. Now, foreign body aspiration, most common lodges in which side? Right main bronchus, because it's quite straight as compared to the left. And pyloric stenosis, string sign is seen in pyloric stenosis on barium swallow and olive shaded mass on palpation. So these are the features of pyloric stenosis. Now, intussusception. इंटरसेप्शन में क्या है? टारगेट साइन और डोनट साइन ऑन यूएसजी. दिस इज नॉट ऑन एक्सरे, इट्स ऑन यूएसजी. Red current jelly stool is seen. So interception, target sign or donut sign on USG and red current jelly stools. Hirschsprung disease diagnosed by rectal section biopsy. And what does it show? It shows the absence of ganglion cells. Hirschsprung disease is diagnosed by rectal section biopsy and showing absence of ganglion cells. I know I'm a bit fast, but the time is less for you guys, and these all 100 points are important. So let's complete it fastly. And celiac disease is screened with anti-tissue transglutaminase, that is PTG IgA. So celiac disease screening test is anti-TTG IgA, anti-tissue transglutaminase IgA levels. BCG dose is 0.05 ml until 1 month of age and 0.1 ml after 1 month of age. Rotavirus vaccine, 5 drops are given. Rotavac, 2.5 ml. Rotacil, given at 6, 10, and 14 weeks. Fractionated IPV, FIPV 0.1 ml intradermal at 6, 14 weeks and 9 months. MR vaccine given at 9 months and 16 to 14 months. Japanese encephalitis, it's a live vaccine given at 9 months and 16 to 24 months in endemic areas. About some milestones. Social smile 6 weeks, head control 3 months, sitting without support 8 months, insert grabs 9 months, walking without support is 12 to 15 months, 2 word sentences 2 years, and drawing a square 4 years. Upper segment to lower segment ratio, important point, 1.7 is to 1 at birth. Questions been asked several times in previous exams of pediatrics. So upper segment is to lower segment ratio 1.7 is to 1 at birth. It becomes 1 is to 1 at what age? 7 to 10 years of age. Bone age assessment as done by X-ray of left hand and wrist, and it's assessed by Gruelich Pile Atlas. So this is about bone age assessment. Now defibrillation dose in pediatrics is 2 joule per kg initial dose, and then it is escalated to 4 joule per kg. Endotracheal tube size uncuffed, age in years upon 4 plus 4. Endotracheal tube size cuffed one is age in years upon 4 plus 3.5. So important for calculation of endotracheal tube size. Fluid bolus in shock is given at 20 ml per kg, NS or RL over 10 to 20 minutes, and maintenance fluid calculation is done by Holiday-Sager formula 100, 50, and 20 rules. So for first 10 kg, it's 100 ml per kg. Then 11 to 20, it's 50, and more than 20 kg, it's 20 ml per kg. So this is Holiday-Sager formula for maintenance fluid calculation. NN-cap formula, sodium minus chloride plus bicarb, and normal it is 12 plus minus 2. Osmolar gap, what is osmolar gap? Measured osmolality minus calculated osmolality. It is significant if it is more than 10. Glasgow Coma Scale GCS score modified for pediatrics. Best score is 15. Is called as an 8 indicates coma and need for intubation. Poisoning, kerosene, gastric lavage is contraindicated in kerosene poisoning. Scorpion sting, prazosin is a drug of choice. Postural hypotension or first dose hypotension is the important side effect. So these were the important 100 one-liners for uh, PDCET pediatric exam, and I hope you all of you guys are preparing well. And just my opinion is that now don't try to read much different things. Just try to revise whatever you have read, and try to revise the important one-liners of previous year questions or important short notes. Okay. So I hope you will get at least some benefit from this quick revision, and I will try to make 1 or 2 more videos before your examination. You can suggest whatever you want for the next 2 3 days, which sort of video I can prepare for you. Okay, so thank you very much and all the best for preparation.